Hello. Thank you so much for choosing to tune in to this presentation today. In this presentation today, I will be discussing the topic of pandas. Now, when I say pandas, I do not mean the cute black and white bears that you can find in the jungles around the world. When I say pandas, I mean a debilitating psychological illness that can rarely arise in young children. In this presentation and lecture, we will be going over some information about this disease and how you can better help people who may suffer from this debilitating illness. So, without further ado, let us begin. Over the course of this presentation, we will be discussing pediatric autoimmune neuropsychiatric disorders associated with Streptococcus infections, and the term PANDAS is an acronym for this condition. Throughout this lecture, we will discuss the pathogenesis of PANDAS. We will discuss diagnosis and other indicators that can help you to identify when a person may have this condition. And finally, we will discuss treatment methods that can better enable you to help somebody who may be suffering from this debilitating illness. So, to begin, let us discuss the pathogenesis. You may wonder, what is PANDAS? What is this condition that affects young children so debilitatingly? Well, PANDAS describes a group of psychological pathologies that rarely arise in young children after they become infected with certain members of the Streptococci family of bacteria. And when you see a case of PANDAS, it probably would arise in the following manner. A young child will exhibit abnormal psychological pathologies, and then when that child is evaluated, you will find that a recent addition to their medical history includes Streptococcus infection. Now, one thing to note, there is a condition similar to PANDAS called PANS, and PANS is an acronym for Pediatric Acute Onset Neuropsychiatric Syndrome. While similar, this condition is not exactly the same as PANDAS. PANS can be diagnosed without the presence of Streptococcus bacteria in the body, whereas a diagnosis of PANDAS requires a Streptococcus infection to be present to make a confirmed diagnosis. So just keep that in mind. And for the course of this presentation, we will only be discussing the condition of PANDAS, where a Streptococcus infection has been present. So, let's discuss the cause of PANDAS in more detail. And the pathogen responsible for causing this illness is Streptococcus pyogenes, also known as beta hemolytic Streptococcus group A. Now, this pathogen can cause a variety of pathologies in children and is commonly known for causing the condition known as strep throat. And usually, when somebody contracts this illness, only physiological pathologies result. However, in rare cases, psychological symptoms consistent with PANDAS can arise. Now, you may wonder, how exactly does a bacterial infection result in psychological pathologies in infected individuals? Well, let's talk about that. So, explanations to psychological pathologies consistent with PANDAS are a debated topic among healthcare professionals. However, the topic of molecular mimicry is one that is commonly supported and has supporting evidence to confirm it. And molecular mimicry is a phenomenon where a pathogen appears so similar to host cells that when the body creates antibodies to try and get rid of the pathogen, those antibodies also attack the body itself. These types of antibodies that end up attacking the body itself are known as cross-reactive antibodies. The psychological symptoms that arise in PANDAS patients are a result of these cross-reactive antibodies crossing the blood-brain barrier and binding to ligands on the surface of neurons in the brain. This causes an autoimmune response against the brain, which then results in psychological pathologies. So, now that we've discussed the cause a bit, let us focus on the diagnosis of this condition and how you can identify it in patients. So, due to being preceded by a bacterial infection, you would likely find physiological symptoms in a patient's medical history. And common physiological symptoms caused by Streptococcus pyogenes include tonsillitis, sore throat, and fever. Gastrointestinal symptoms can also be present in younger children, which commonly consist of nausea and vomiting. And another test that you can run to determine if a Streptococcus infection is present would be an antibody titer test. Antibody titer tests allow you to determine if antibodies to Streptococcus pyogenes are present and can help you perhaps confirm a diagnosis of PANDAS. Along with the psychological symptoms of PANDAS, neurological and direct physical symptoms can also result. These can include abnormal motor tics and other odd movements of the body, issues with concentration, sleep issues and other troubles and disorders with sleeping, and abnormalities surrounding diet, so strange eating patterns and other odd feelings about diet. Now, let's discuss the psychological symptoms that can arise in PANDAS. Now, interestingly, the psychological pathologies and symptoms that can arise in PANDAS patients are quite broad. Or in other words, all kinds of psychological symptoms can result due to this condition. Symptoms consistent with obsessive compulsive disorder can be present in PANDAS patients, as well as symptoms including fear, anxiety, panic attacks, as well as emotional abnormalities such as mood swings and depression. Now that we've discussed diagnoses, let us discuss treatment protocols and other methods that can help you treat individuals with PANDAS. Behavioral therapies are a good method to approach from a psychological perspective. A good choice is cognitive behavioral therapy. This has been shown to improve symptoms of OCD in PANDAS patients and is an easy method for any psychologist to use. Psychological drugs can also be used to help treat PANDAS patients and alleviate their symptoms. SSRIs, or selective serotonin reuptake inhibitors, can help PANDAS patients manage their symptoms of obsessive compulsive disorder. And in clinical studies, medications that treat ADHD can help PANDAS patients. Antipsychotics have also been shown to help, and anxiolytic medications have also shown improvement in psychological symptoms. Now, let's move on to antibiotics. Now, you may be thinking that since PANDAS is precipitated by a bacterial infection, that antibiotics would be helpful. This is a complex topic. Antibiotics have been shown to improve psychological symptoms in PANDAS, and this is because they lower the amount of pathogenic bacteria present in the body. However, remember the cross-reactive antibodies that we discussed earlier. Antibiotics do nothing to directly treat or manage those cross-reactive antibodies. Antibiotics can indirectly help by reducing the amount of pathogenic bacteria present, which then in turn reduces the amount of cross-reactive antibodies generated by the body. So yes, antibiotics do help, albeit indirectly. So let's wrap up with some conclusions and final thoughts. To kind of sum up, PANDAS is a psychological disorder with an interesting biological origin. It originates from responses caused by cross-reactive antibodies crossing the blood-brain barrier, and these antibodies are developed in response to the bacteria Streptococcus pyogenes. And this clinical disease can manifest with various different symptoms, including psychological symptoms, and in the acute stages of bacterial infection, physiological symptoms. And many treatments have been shown to help patients manage their symptoms. Some were discussed in this lecture. There are others, and I would encourage you to research for yourself other treatments that may be helpful. And that is about it for now. So thank you for tuning into this presentation, and I hope you were able to learn something today and use this information to help people who may suffer from this illness. Thank you for listening to my presentation.